To Zimbabwe now, where healthcare officials have declared a state of emergency in the capital, Harare, due to a cholera outbreak. At least 20 people have died and another 2,000 are being treated for the diarrheal disease. CGTN's Farai Mwakutuya has the latest.
In the week since the first case of cholera was reported, the disease has spread rapidly. 20 people had succumbed by Tuesday, and those needing treatment kept coming in to treatment centers in Harare. Medical personnel are up against a formidable adversary.
In our particular case, we've got a very difficult one actually, because we've isolated 3 species of germs in simple terms, in layman's terms. You know, one called Salmonella, and the other one called E. coli, and the other one which causes typhoid. You know, so, and the doctors have also identified that there is some resistance to antibiotics, except for one other particular antibiotic. We are declaring an emergency for Harare, and this will enable us to be able to contain the cholera, typhoid, and whatever else, you know, is going on. You know, we need to have that opportunity to be able to ensure that we get rid of the problem as quickly as possible.
Development partners are bracing for a demanding response.
We have already mobilized quite significant resources from, as I said, the UN in general, UNICEF and WHO in particular. We are also talking with our different partners on the ground, DFID and others, to make sure that we mobilize more resources. We have alerted our regional offices and headquarters because we know this is a very serious issue which will need, going forward, quite huge investments to contain the outbreak.
Glenview is the epicenter of the outbreak. Burst sewer pipes, uncollected refuse and erratic water supplies mean squalid living conditions for its residents.
We have to go to nearby bars to use the toilet because the sewage pipes in our homes don't work properly. We are tired of reporting the faults because the council officers always promise they'll come to attend to them, but never do.
Now that the health time bomb has gone off, council has finally sprung into action.
New sewer pipes are being laid to replace broken down ones. Clean water will be transported here and distributed to residents, and there are restrictions on food vending, all part of an emergency response to this outbreak.
Health promoters are also on a door-to-door campaign to encourage good hygiene. With so many already infected, these diligent foot soldiers hope they aren't too late to win a battle that could save many in their community. Farai Mwakutuya, CGTN, Harare, Zimbabwe.
Well, let's cross to Zimbabwe's capital, Harare, now for an update from Farai. Farai, thank you for joining us. What plans are in place to deal with this deadly cholera outbreak?
Well, Karen, the government has effectively come up with a 3-pronged attack. Number one is to ensure that there is adequate resources and manpower to deal with people who've already presented themselves and have already been infected. People who are coming into these treatment centers are already there, and the government says it must first of all be able to care for them and provide them with the drugs and medication that they need. Secondly, it's trying to prevent further infections, and it's largely doing that by this move to clear out refuse that had been uncollected, to fix this water reticulation system, clear out the sewages, disinfect some of the filth that is in some of these suburbs, particularly in Glenview and Budiriro, which are the epicenters of this disease. It's also on an awareness campaign to try and encourage people to be, more safe in what they eat, to drink safe water, to use safe water sources, to wash all the food that they eat, and to only buy from safe places. But I think the most difficult part, which is the last leg of the strategy here, is to try and ensure that it contains and restricts the outbreak to the areas where it's been identified thus far. And this is to make sure that it doesn't spread to other parts of the country. Already there have been isolated reports of cases in Masvingo, for instance, about 400 kilometers from Zimbabwe. One person had traveled to Harare, traveled back there and died. Unfortunately, there are 2 other cases in a place called Buhere in the eastern part of the country. So that is the other challenge, to ensure that people who may have already be carriers of these germs don't spread it beyond the areas that are currently identified as the epicenters, Karen.
And Farai, this is not Zimbabwe's first cholera outbreak. Many more people lost their lives back in 2008. Is the health ministry equipped to deal with this latest outbreak, do you think?
Well, certainly the health sector has been largely underfunded over the past few years, and will obviously face those resource constraints. But at this point, the health minister says that enough money, enough resources, enough manpower have been availed, and that's also due to the assistance that's coming through from development partners such as the UN, WHO, Médecins Sans Frontières, and also the corporate sector that is coming in. We've seen a number of corporates that are helping, bringing in trucks of clean water into some of these communities. So from that point of view, government is quite confident that it can mobilize enough resources to deal with the challenge as it stands. But a key challenge as well that was pointed out by the minister is that this particular strain of cholera that is being seen now has developed some sort of resistance to the antibiotics and the treatments that would traditionally be used to deal with it. Also the fact that there are 3 different germ types that are seen here. So there's typhoid, there's E. coli, amongst others. So being able to find the right medication, the right drugs, and being able to administer them to all the people that need them would be a bigger challenge in this particular crisis that we're seeing now. This particular outbreak has its own unique set of challenges, and I think the government will need to work a lot harder and mobilize more support to be able to deal with that.
And Farai, finally, talking about the government, this outbreak coincides with the appointment of a new cabinet. Would you say this is a litmus test for the new government, taking into account the other challenges that the country faces right now?
Well, indeed, I think it is a massive test that this health minister is being effectively thrown into the deep end to deal with this crisis, or, this outbreak as it unfolds. And I think it will be a test of this new government, A, in terms of how it deals and responds to an emergency. Secondly, it will be a test of how it will commit resources and prioritize resources to deal with this crisis as well. Perhaps redirecting funds that were meant for something else and channeling them to this, unfolding crisis, making sure that we are able to deal with it and that it doesn't spread further. But I think thirdly and most importantly, it will also be a reflection of how well this government can deal with long-standing challenges and deep-rooted problems that Zimbabwe has been facing. Cholera, typhoid, those type of diseases are a symptom of much deeper lying problems. The fact that water reticulation, sanitation has broken down, service delivery in terms of refuse collection doesn't work anymore, it's not efficient anymore. Those are things that will need to be addressed on a much larger scale, on a more holistic scale. Also the fact that food is being sold, people are vending food in unsafe places is a symptom of the fact that they don't have jobs, and so they're turning to this as the only economic activity, as a way of getting a livelihood. So if they are able to create jobs to solve the economic problems, there won't be that many people vending. So it is a test immediately in terms of dealing with the crisis, but on a larger scale, it's the government's ability to be able to put in place solutions to some of Zimbabwe's long-running problems.
Okay, Farai, thank you for that. That was Farai Mwakutuya for us in Harare.